Medicare and you've got all these things that you need to know, but you do. But we're here to help you at any time. So on page 13, you'll see that this little chart might help demonstrate supplementing Medicare for you. And it just does describe the original Medicare. There is a gap of that 20%, and then you get a standalone drug plan. Or you could go the Medicare Advantage route, which is the one-stop shopping, and have everything bundled in one if you choose to take a drug plan. And there are pros and cons that go with that, and we've been talking about that. The difference between the supplement and the Medicare Advantage plan, the supplement premiums could be higher, but if you go to the doctors frequently or outpatient therapy and you're paying a lot of co-pays, you may end up paying more money than you realize. It's just a little bit at a time instead of that bigger check in the month. When you have a supplement plan, you have the freedom to choose your doctor without any referrals. So as long as your doctor or the provider takes Medicare, they will take your supplement plan. With the Medicare Advantage plans, you do have the network, and that network might work just fine for you, but keep in mind you are restricted to that network. With a supplement plan, there's no referrals necessary. If you heard about a great cardiologist at Mass General or Leahy Clinic or Winchester Hospital, whatever, and you have a supplement plan and you want to go see that doctor, I would advise you to let your primary care physician know that you want to go see that doctor, because you want to keep that doctor in the loop, but you don't have to get a referral to go see that doctor. If you have a Medicare Advantage plan, you do have to get a referral to see specialists.
Even under the PPO?
Under the PPO, you have to check with the plan. You can go out of network, but you'll pay more. You'll pay a higher copay.
Okay.
And I would check with the plan whether or not you need a referral. Okay?
Okay.
So you may want to check to see if you need the referral. You certainly can go out of network and you will pay more for a copay. So let's say a doctor's office visit is $15 in the network with a PPO. Out of the network, it might be $40 for a copay. Okay? But that's fine. But you want to just make sure that that's so. The PPOs have a little more flexibility. It costs you more money, but you have more flexibility.
Okay.
It's fine to do that. With the supplement plan, you are covered anywhere in the United States that takes Medicare. They'll take the supplement plan. If you have a Medicare Advantage plan, it's only emergency coverage if you're out of the network. Okay. Any other questions about that? I mean, these are when the confusing decisions come into play.
How can, is there like a, where could you go to have somebody rate these companies as far as?
The Medicare website actually has a rating system right on it. You can get on the computer, Medicare.gov, and you'll see all the plans listed there. The Shine Council can help you with that as well.
There's a site?
It's up to a 5-star plan, so you'll see the ratings. And there's a customer service ratings of those plans. You see a lot of 2.5, 3s, 4s. Got a lot of 5s out there, but there are some out there. Okay, and they get rated every year. And they're in the book as well, okay? But they kept up to date on the website, because they're always updating those. And sometimes they get sanctioned. If there's problems, the plan will get sanctioned and they can't enroll new people. So, yes.
We all brand each other.
Does the open enrollment period change from year to year, or is it always the same thing?
This is the first year it's changed in a long time. It had been mid-November, I don't even want to say the dates, okay? The Affordable Care Act changed the dates. To October 15th to December 7th. As Shine Councils, we're really happy on New Year's Eve that we're not finding drug plans.
Out there for last minute.
And there were people, I mean, you can, by the way, you can always call Medicare. There's an 800 number for Medicare, and it's in the handouts here. It's 24 hours a day, 7 days a week. So they will help you choose a drug plan or a Medicare Advantage plan over the phone. Keep that in mind. As it gets closer to the end of open enrollment, if you can't get an appointment with a Shine counselor, you can definitely call Medicare. They'll be happy to help you. But unless Congress changes the dates, I'm hoping these dates stay the same, for now. It does make it a little bit, it's actually a few more days in the open enrollment, and it does get us out of most of the holiday season, not the entire holiday season, but it does make it a little bit easier for us. So again, before enrolling in a plan, I know you're tired of hearing me say check with your doctors, but check with your doctors before you enroll in a Medicare Advantage plan. And you want to make sure that all your drugs are covered under that Medicare Advantage plan or in the standalone drug plan, the Part D plan. On page 16, you'll see some phone numbers here. There's the Shine office in Malden, and you can feel free to call us, and we will do our best to, we can usually counsel you on the phone, or you can come to Malden to make an appointment. You can make an appointment here with Jeff. If you live in other cities and towns, there's a list over there, there's a flyer that's just a brief description of the Shine program, but on the back you'll see all the cities and towns that we go to in this region. So you may have some friends and neighbors who live in Melrose or Wakefield or Reading. We have Shine counselors at all those centers as well. That's a good thing to keep on hand. You can call Medicare, as I said, the phone number is right here, 7 days a week, 24 hours a day. Can't sleep at 2 o'clock in the morning, give them a call. In fact, that's probably the only time you're going to get to them at this time, but that's a good time to do that. You can go to the Medicare website. A lot of people try to, attempt to find the information themselves. Then maybe you want to check in with Jeff to say, I think I did this right, does this sound right to me, or explain a few things. Lots of things to click on in terms of, you'll see little symbols, an N will say national program, or it might say quantity restrictions. If you click on that, it'll explain what that means. Or, not on the formulary, well then it's not in that plan, you might have to find another plan. But, play around with it. You can also call Mass Medline. Mass Medline is a wonderful service that comes out of the Mass College of Pharmacy out in Worcester. They've been around for a few years. It's staffed by the pharmaceutical students. And again, it's free of charge. I believe it's a Monday through Friday, kind of a 9 to 5 type of thing. But they can help you choose a plan. So if you can't get to a Shine counselor, you really don't want to be on the phone for a long time with Medicare, you don't want to fire up the computer, but you want to talk to somebody, Mass Medline will take your information over the phone and can give you some choices over the phone. Another thing with Mass Medline to keep in mind, and I just wouldn't call them for this during open enrollment that I'm going to tell you about because they're so busy as we are, they will do a review of all your medications. Let's say, after you go to 2 or 3 different doctors and kind of manage these things on your own and you're not keeping your doctor in play. And maybe what you want to say is, gee, I want to make sure that I'm not getting any interactions or it's okay to do all, or you want an independent opinion on this. They will take the names of all your drugs over the phone and they'll let you know, you might want to check with your doctor if you're taking this, don't take this, or don't take it at the same time. Maybe take one in the morning and at night check with your doctor. They don't charge for that service. And it's a great service, and I recommend that highly to people. I also recommend to people that you do get your prescription drugs from one pharmacy. I mean, even if you do mail order, occasionally you're going to get the antibiotic down the street because you're not going to do mail order, you need an antibiotic. But your pharmacist is your best friend. The physicians depend on the pharmacist to tell them what's going on with all the new drugs and the interrupt. They get the news before the doctors do. Their job is to read that first, and then the doctors get the information. But they're a wonderful, wonderful resource for you. My late mother-in-law, who lived to be in her early 90s, liked to shop around for her pharmacy. She lived in a small town. She didn't want anybody to know her business. So we went to the pharmacy in Ayer, we went to Groton, we went to Lowell. Because she lived, to be in her 90s, so it did. But I was always worried, she's going to, one of these days, take something, the other pharmacists aren't going to know about it. But you go to the pharmacy and they go, you've been taking this blood thinner, maybe you shouldn't be taking that, whatever. But it's a wise thing to do to stay. The mail order pharmacies have pharmacists. They will call you. Or you can talk to them on the phone and ask them questions. But I would recommend taking your drugs, if at all possible, from one source for your safety. Okay? So let's say you sign up for a Medicare Advantage plan today to be effective in January. The middle of January, you realize your doctor is not in the plan. You didn't check. What are you going to do? Am I stuck with that plan? No, we have the annual disenrollment period. The annual disenrollment period. That's just to keep you guessing. The annual disenrollment period. This is our second year of the annual disenrollment period. It starts January 1, so New Year's Day you can discover this. It goes till February 14th, Valentine's Day. And it's when you can get out of that Medicare Advantage plan that you probably shouldn't have signed up for to begin with. Or now you're going to find out, I'm going to Florida for 2 months. I got to get something else. You can get out of the plan, go back to original Medicare, pick up a standalone drug plan, and if you want a supplement plan, you can do that. Okay? It doesn't let you switch to another Medicare Advantage plan, however. Those rules changed. You used to be able to do that. But starting this calendar year, you can only get out of the plan, go back to original Medicare with a supplement plan, or if you want to switch the drug plan, however you took your drug plan, you can do that during the annual disenrollment period. There are many, many exceptions to the rule. They're called, enrollment periods, separate enrollment periods, but special enrollment periods. But you generally don't want to have to deal with that if not. You really want to stay within open enrollment to get everything done, get it done right, you don't have to change. But again, if there are some rules and circumstances that happen, this is when you want to go see a shine counselor to see if there's a way that you can change something for whatever reason. That's it, that's all I have. Can I answer any questions? Happy to answer questions, yes.
I already have a thing from AARP for $20 a month. So it's not gonna come out of my social security?
Oh,
check?
no. In fact, the only thing that should come out of your social security, they may give you the option of doing that,
Okay.
but unless you proactively click on a box for that, because your Part B premium comes out of your social security check. That's the only thing I recommend to people. It's funny, because people say to me, pick a plan, tell me what to take. We really can't. We can offer you some choices. But we always say it's your choice.
Okay.
But when it comes to taking anything out of your social, because if you have to change that, changing something that comes out of your social security check, it's just another headache. So your Medicare Advantage plan, or your supplement plan, or your standalone drug plan, have them bill you however, whether it's monthly or quarterly, depends on the company. But that's how you don't take it. You can do direct payment out of your checking account or your credit card. Don't have it come out of your social security check. You will regret that. It takes like 3 or 4 months before anything gets. You'll
Okay.
never know what you're doing.
Well, it was the same price last year, so.
Right.
And
And
this
you
year
don't have,
it's
if you're happy
$20.
with your plan, you don't have to change your plan. But this is the time of the year to do that. Sometimes formularies change with the drug plans. You might say, let me just make sure I have the right plan for me. It doesn't cost you anything.
Well, I have
to sit here and
Walgreens,
test.
because that's like 3 months for $13, which is,
Yeah, well, it comes out of
Some
your,
of the
you
generic-
have
no,
your drug plan with your
that's
AARP plan.
$20 a year for that plan.
But that's not a health
No,
insurance
but
plan.
I mean, that is another option for people.
But it's not a Part D plan, and they'll get a penalty if they sign up for that. If it's just a discount card,
Okay.
that's not a Part D plan. Your AARP Medicare Advantage plan has drug coverage in it. That's the drug coverage you're getting when you go to the pharmacy.
Okay.
Now, if you bought a discount card, bought into a discount program through Walgreens or CVS, that's fine, that may give you some additional discounts, but that's not a Part D drug plan.
Okay. I need
It
to
doesn't
talk to them
replace
about
it.
that. Okay.
You've got other coverage, you're really paying for your coverage.
Okay.
You probably don't even need, I don't know, ask them if you didn't have that $20.
Now, the other thing I wanted to ask you, like, say scooters and things, can you buy secondhand ones and
Usually not.
that's a
They-
shame, it saves
You
so
have
much
to buy
money.
any durable equipment. You could buy them secondhand, but Medicare won't pay for them.
Oh, that's a
Second.
shame, Medicare would save a lot of money.
Well, I think they want to make sure people get, good
Yeah.
quality equipment, and they only let you go through, that doesn't mean you can't get good quality secondhand, but they can only control it that way. They authorize certain vendors, so whenever you need any durable medical equipment, DME, those are the letters you'll see in the Medicare book frequently, you need to make sure that your vendor is a Medicare vendor, a Medicare approved vendor. Because, the store down the street might be a great place to do business, but you might not be able to bill it to, they might not be able to bill it through Medicare. And Medicare will not pay for it if they're not an approved Medicare
Oh, that's good to know.
vendor. Very, very important that you check, even for medical supplies. If there are, supplies that you need, for your health care at home, you need to get them through an approved supplier. The Medicare website actually has a list of all the supplies. If you're inclined to sit at the computer for a while, go to Medicare.gov. You'll see a wealth of information on there. And you can look up a supplier. You put in your zip code and it will list suppliers within 3 miles, 5 miles, 10 miles. And you'll see who's a Medicare approved, but your doctor has to write the prescription for it. You're only entitled to so much equipment per year. But if you do your homework, you'll find out.
Well, I wasn't thinking of me, I was thinking.
But for other people, and there are some other services, I don't know if Jeff wants to mention